Something strange happens when you walk into a pharmacy. Rows of sleek bottles, chemical names, brand logos, all backed by years of research and clinical trials. But if you trace some of those ingredients back far enough, you'll find something unexpected. Roots, herbs, tree bark, even rituals that were once considered witchcraft. The modern medical world may look high-tech and advanced, but some of its most effective treatments come from the same place people once feared: ancient remedies used by healers who were once accused of being witches. Witchcraft has never had just one meaning. In some cultures, it's spiritual or even sacred. In others, it's something dark and threatening. But one thing is consistent: witchcraft is often linked to the use of nature to influence health, luck, or events. That's where the overlap begins. Because what we now call medicine often started out as witchcraft in the eyes of society. Take something as basic as willow bark. It was used for centuries to reduce fever and pain. People didn't know why it worked, just that it did. Eventually, scientists discovered its active ingredient, salicin. That became the basis for aspirin, one of the most widely used drugs in the world. But back in the day, using willow bark to treat pain could get someone accused of being a witch. The same thing happened with many natural remedies. Foxglove, a plant that can be deadly in large amounts, was once part of folk healing. Now it's used to make digitalis, a drug that helps regulate heartbeats. Opium poppies, once part of healing rituals and even religious ceremonies, became the foundation for morphine. Even moldy bread was once seen as dangerous until scientists realized that certain molds kill bacteria. That's how penicillin was discovered. So what does this tell us? It shows that traditional healers, many of whom were women, had knowledge that modern medicine now depends on. But back then, that knowledge was misunderstood. In Europe and North America, during times like the Salem witch trials, people were killed for using herbs or making healing potions. In places like Nigeria, India, and Tanzania, that fear still exists. Even today, traditional healers can be accused of witchcraft and attacked. It's not just history, it's happening now. In Zambia, people with HIV/AIDS are sometimes blamed for using witchcraft to spread the disease. Some of those accused are doctors. In Papua New Guinea, people have been burned alive for being suspected witches. In India, women have been chased from their land because neighbors believed they were casting spells. These fears haven't gone away, they've just changed form. What makes it worse is that these accusations often target the most vulnerable. Older women, children, people who look different, like those with albinism in Tanzania, are frequently blamed for problems like illness, crop failure, or even someone else's success. And while people argue over whether witchcraft is real, the violence that comes from it definitely is. That's where modern medicine has a chance to do more. Not just by using the science behind traditional remedies, but by helping break the fear around them. In South Africa, the government took a different approach. Instead of denying people's beliefs, they educated communities about how disease really works. They trained police to work with traditional leaders and made it clear, if someone gets hurt over a witchcraft accusation, the person who made that accusation is responsible. That kind of approach can save lives. Because the truth is, there's never been a proven case of real witchcraft. No spell, no curse, no magic potion has ever held up to scientific proof. But there are thousands of proven cases of people being killed or abused because someone thought they were a witch. While people are still being punished for using ancient healing practices, those same practices are quietly powering parts of modern medicine. We've just changed the language. A healing ritual becomes a clinical trial, a potion becomes a prescription, a plant becomes a patented drug. And the person once feared as a witch? In today's world, they might just be called a researcher, a doctor, or a pharmacologist. So the question isn't just why modern medicine still uses ancient witchcraft, it's why the world still treats the source of that knowledge with fear instead of respect.